Hi, my name is Stacy Brock. I am a registered nurse here at Carteret Healthcare, and I'm also the orthopedic clinical coordinator. Thank you so much for opening up this email with a video today. We're going to talk about your upcoming knee replacement. This is your pre-op knee class. We feel that this is super beneficial to you because our goal is to help you have a happy, healthy, and safe recovery. And the most important thing is safety. So what we're going to do is we are going to focus on the entire process from start to finish. We're going to talk about how to prepare yourself at home, what's going to happen while you're here at the hospital, and then what is going to happen when you leave. This should take us about an hour, give or take. And y'all are very blessed that with a knee replacement, you don't have any kind of precautions in place like a hip patient would. So let's start out with how we normally sit in the chair. And this is important because after a replacement, you are going to have to get up and down a little bit differently than what you're used to. So right now, while we're sitting in the chair, our feet are flat, our shoulders are over our hips. This is our nice neutral position. Most people tend to say that they are comfortable in the chair, and a lot of patients are actually sleeping in their chair right now, whether it's a recliner, whether they're on their sofa, but it's a lot easier for patients to get up from a seated position than it is to have to try to get in and out of bed. A lot of people find that they're just uncomfortable, so this is going to be incredibly beneficial for you. I do recommend that you have somewhere like a recliner, a chair, a couch, have an ottoman, something that you can elevate your legs on. All right, so we're sitting in our chair. We're in our nice neutral position. One thing to think about is that it is a lot easier to get up and down if you're sitting on the edge of the chair. So if you lean back and scoot your hips forward, you can very easily get to the edge of the chair. Okay, my body center of gravity is all right here on the edge. You're going to take your surgical leg, the one that we operated on, and you're going to put that forward. And you can kind of see here in the picture, this foot is just a little bit more in front of the other one, maybe about 6 inches or so. Okay, I don't want this, I don't want this, I don't want this, don't want this. Literally just a little bit more in front of the other one. This leg is going to be tucked underneath you because when you stand, your body weight is going to shift to your non-operative leg. This is a protective mechanism. Have a chair that has armrests. That's going to be incredibly beneficial, and just push up straight. That's the part that's difficult for a lot of people. Most of us aren't normally used to standing up straight. Most of us tend to get that heave-ho and push themselves forward like that. That is problematic after a joint replacement because your center of gravity shifts, and when you lean too far forward, your risk of falling increases. The last thing you want to do is have to call your doctor because you fell. So let's practice that getting up and down again motion again. So we're sitting in our chair, nice neutral position, lean back, scoot your hips to the front of the chair. Now we're sitting on the edge. Extend your operative leg in front of you just a little bit, maybe about 6 inches in front of the other, and then this leg is tucked. Put your arms on the chair, press up. Okay. The reason I show you this and I demonstrate it is because I want you to think about all the places in your home where you sit, whether it's in the recliner, whether it's on your bed. Think about things like your kitchen table and chairs. My kitchen chairs don't have armrests, so that's going to be a different way for me to have to get up and move. Think about things like your toilet, which we'll talk about in a little bit too. So being cognizant of all the different areas that we sit is going to help you to prepare to get up and down and have a safer recovery at home. So when you're sitting in the chair after surgery, the most important thing is if you are not up and walking, I want you to have your legs elevated. So let's take a look here, for example. If I am sitting on my couch and I have my legs elevated on my ottoman, okay, this is fine. Some people will say, well, Stacy, do I have to have my knee elevated above my heart? Nope, we're not doing any weird yoga. We're not hanging ropes from the ceilings, nothing crazy like that. just having your legs elevated is beneficial. If you wanted to elevate your leg further, you are more than welcome to. But I only want you to put a pillow from your ankle to your calf. One of the important things after a knee replacement is that you do not have your knee in a flexed position, okay? Our goal is to get the most extension and flexion possible as you're moving. And always remember that motion is lotion after a joint replacement. So elevate extra, I could put my leg up more like this, but I'm only going to put the pillow from here to here. Leave nothing underneath the knee. You want gravity pushing down, helping you to get that extension, okay? Otherwise, I'm propped up and I'm recovering from surgery. So we've already talked about how to get up and down. We've talked about the importance of elevating your legs afterwards. You're going to have a lot of swelling after surgery. That's very normal. If you keep your legs down like this in what we call a dependent position, you're going to have more swelling. So up, recliner, ottoman, couch. Okay. Now let me introduce you to one of your new best friends. This is Wilma Walker. She is a bit clingy, so she is going to be with you for quite a while. And Wilma is really meant for balance and stability. We've all seen the walkers that are the Cadillacs, that have the seat that you can sit on, that have the brakes. The reason our surgeons do not want you to use those after a joint replacement is because they are just not steady, okay? The four wheels make them a little bit less stable. This, your good old Buick, is what's going to be beneficial for you afterwards. So let's talk about how to use it. Your walker is set to your height. If you do not have one, we will provide one for you here at the hospital. And everything that I give you to take home after a joint replacement is yours to keep. Nothing has to be turned back in. So when I am standing up, my walker is set to my height. If you're ever wondering if the walker you have at home is at the correct height, you want the top part of the handle to be right about where your wrist is. And you can see this is where mine is. And when you walk with the walker, you can see that I actually have a better sense of posture, okay? I am walking inside the walker. This is my cage of security so that if something were to happen to me, I could catch myself. If I'm walking like this, that's a no-no. I say that specifically because if I'm out here trying to get to my walker and my knee gives out, I'm down on the ground, okay? When you walk inside of your walker, if my knee were to give out on me, I can catch myself, all right? So we're walking with our walker, slow and steady, just like this, always looking out in front of you. Your body follows where your head goes, so pay attention to that. All right, so now that we were up and walking around, we're gonna go ahead and sit back down in our chair. One other thing about walking with your walker is you don't wanna be whipping it around. You also don't want to walk with your walker, okay? Keep it down on the ground. And whenever you turn, it's gonna be small, slow movements. This is not a sprint, this is definitely a marathon. So I'm going to get to my chair and I am going to walk back until I can feel it on the back of my legs. Okay. Now that I'm here, I'm going to reach back. I'm going to extend my operative leg forward and I'm going to ease myself down. So now that we've seen how to sit down, let's put everything all together. Again, this is where I want you to think about all the areas that you might be sitting because you're going to have to try to get up from them. So your walker is going to be put in front of you just like this. You want her here. You do not want her here. If it's all the way out here, your natural inclination is to try to grab here or to grab here, and you can't get up like that safely, okay? So put your walker right here. Extend your operative leg in front of you, and I'm already sitting on the edge of my chair, okay? My non-operative leg is tucked in, and as I stand up, I'm gonna push up and grab onto my walker, and then I'm gonna start walking, just like that. So let's try that again so you can see. We've already practiced, so we're in the chair. I'm gonna lean back, scooch my hips forward till I'm on the edge. My walker is gonna be right here in front of me. My operative leg is forward and my better leg is tucked. And I'm gonna push up here on my armrests, just like that. And now I'm up and now I'm moving. When we talk about things earlier, like I said, think about where you are, think about your toilet. It's not glamorous. Some people don't have a handicap height or they don't have a chair height toilet. After a knee replacement, you do not have to have an elevated toilet seat, but I tend to encourage all of my patients, have what you need at home. Have any kind of equipment that is going to make you more comfortable and have you have a safer and a faster recovery. You don't want somebody to have to run to Walmart at 3 o'clock in the morning because you don't have what you need. So think about something. I like an elevated toilet seat that has armrests. Those are great because you can push yourself up and down off of the toilet. There's a lot of different kinds of equipment out there. There's a lot of things that you might want to have at the house. Definitely utilize your resources. We are very blessed to where we live, that between our congregations and our churches, a lot of times our areas of worship have these things there from other practitioners. So check with that. Our neighborhoods are great. A lot of times people will say, oh, I had a hip replacement 3 years ago. Let me just get it out the garage for you. Other places like thrift stores, they almost always have some kind of medical equipment available. So take a peek around, look and see what you need. The only other thing that you will need after having a knee replacement is somewhere to sit down in the shower. Does it have to be a shower chair? No, not specifically. You just need something to help you safely get up and down. Some patients have said that they have used a metal folding chair, a piece of lawn furniture. Look around, see what you have at home. That way you know if you need to buy it, you can buy it ahead of time. I do strongly encourage people to have grab bars. I do not like the suction cup grab bars because I don't feel like they hold quite as well as we would like them to. So really, take a good survey, see what you need. So we've already talked about getting up and down. We've talked about using our walker, the importance of elevation to help reduce the swelling, not to put anything underneath your knee because you want to be able to get the most extension and flexion from it possible while you're recovering. Now let's talk about anything in the house that can trip you up. And this is typically one of those things that we don't normally think about. Scatter rugs, power cords, those are all the typical culprits. But look at other things. I have 2 German Shepherds. My dogs have bones, balls, defluffed stuffed animals everywhere. Those are my personal trip hazards. So really take a good look around, okay? You need to be able to get around with your walker without having to have to get tripped up. So now that we've got a good area of the house and we've prepped everything and we know what we are going to anticipate, let's think about what you need to bring with you while you're here for surgery. Loose, comfortable clothes are key, okay? After a replacement, one of the important things is the doctors are going to want to see your bandage first thing in the morning, and the nurses are going to be constantly assessing your incision as well as the surrounding area. So let's think about something that's loose and comfortable. I wear these pants on purpose to prove a point. Right now, they're pretty baggy. You can see that I can pull these up pretty high ahead of time. So if I had a bandage on my knee, the nurse would be able to take a look at it. Think about how swollen my leg is going to be after surgery. Chances are those pants that are here, I'm only going to be able to get to here. So I recommend buying a pair of pants that are maybe a size bigger than what you normally wear. Shorts are fabulous after a knee replacement. Something that I had a patient tell me was that they bought a pair of sweatpants or they picked a pair up from the thrift store and they cut them right about here on the calf. That way they're nice and stretchy and we can get them up and moving. So that helps us to assess your incision and to assess your legs after surgery. So you've got a good pair of bottoms on. Next, I want you to wear a t-shirt or something short sleeve. You will have an IV in place after surgery. Typically, we like to put it in your hand, maybe somewhere else on your arm. But this is your lifeline. As a nurse, that's something that we really like to have always available, because if there's an emergency situation, we can give you medication quickly. So that IV is going to stay in place until you leave the hospital. The next thing is, God knows if it's going to be 37 or 73. So I highly encourage everybody to bring a hoodie, a sweater, something else to keep you warm. Okay. And then lastly, for things to bring, one of the big things for me is your footwear. Okay. We really, really, really can't stress the importance of having a pair of shoes that you can just slip your foot into. So for example, the pair that I have on right now are nice because I can literally just put my foot in and that's it. A pair of sneakers that are laced loosely. Some people wear boat shoes, some people wear house slippers. I just don't want you to wear flip-flops or Crocs. You need to have your heel and your toe covered, because if you cannot pick your foot up, the chances of you slipping out of your shoe are a lot higher. All right. So we know loose, comfy clothes, something short or stretchy, a t-shirt, comfy sweater, good pair of shoes. The other things that I want you to look at, maybe possibly bringing, if you are a patient that uses a CPAP machine, I need you to bring that with you. Bring the mask. We have sterile water, so you don't have to worry about that. If you take injectable diabetic medication, I need you to make sure that you either bring that with you or that you know when you need to take your last dose of medication. So that's important. Other than that, the only other thing that I would recommend you bring with you would be your inhaler if you utilize some kind of inhaler. Otherwise, money, medication, and jewelry can all stay at home. You don't have to bring any of that. And then I'm a big fan of just having a to-go bag with you. Whether you spend the night or whether you go home same day, we never know what's going to happen. So always just have your creature comforts with you, have an extra change of clothes. So now that we've got everything packed, we know what we're going to bring, let's go on to the next step. At your preoperative interview, you will have received this pink bottle from the nurse. The nurse is going to tell you the medications to take. She's also going to tell you what to stop, and she's going to talk to you about this. This is Hibiclens. This is also called chlorhexidine. This is a very, very strong cleaner. The goal is to get as much bacteria off of your skin prior to surgery as possible. Two things to note about this: do not put it on your face or your private parts. And this is extremely drying, okay? Some patients have said, well, can I keep that bottle and use a little bit of it after surgery to clean around the incision? No. You're gonna shower with half of this bottle the night before surgery from the neck down. Do not put it anywhere on your face. Do not put it anywhere on your privates, okay? There is a designated amount of time on the bottle that it wants you to sit with that solution in place. Try to sit as long as you possibly can. When you go to bed that night, have fresh sheets on your bed so that you're getting into a clean bed. And then when you wake up in the morning, you're going to do the same thing. You're going to shower with the other half of this bottle. From the neck down, do not put it on your face or your private parts. And if there's anything left, pitch it in the garbage. Okay? So we've showered with our super antibacterial cleaner. We've gotten dressed and we are ready to go. When you come in, you are going to come into the big glass rotunda entrance. At that point, you're going to stop at registration. You're going to get your beautiful ID bracelet and you're going to take the elevators right there to the second floor and then turn left. This is where you've had your pre-op appointment with the nurse. This is also where we get you ready for surgery. When you come in, they are going to get you in a hospital gown. You're going to get that beautiful IV put in place. And then at that point, we're going to have you wipe off with some more bath wipes that are antibacterial. We're going to swab your nose. You are going to talk with your surgeon, and you're also going to talk with the anesthesiologist. After that is done, you go to the operating room. Your family waits in the waiting room, and the procedure only takes about an hour and a half to 2 hours. Not bad. When it's done, the doctor's going to come out and let your family know that you did marvelous. And then at that point, you get whisked away to the recovery room. Your family will come up here. You can't see it right now, but I am in our physical therapy room on the surgical floor. All of our rooms are private rooms, which means you don't have a roommate. You have your own bathroom, pull-out couch, recliner. So if somebody is going to spend the night, they are more than welcome to. And then when you come upstairs, this is when we start talking about hitting your milestones. This is a good way for the nurses and your physicians to assess your recovery process and making sure that you're where you need to be. Regardless if you go home same day or you spend the night, these 4 things we have to accomplish. So first and foremost, you're going to be hungry. You haven't had anything to eat or drink probably since about 6, 7 o'clock the night before. Anesthesia can make you extremely nauseated. So one of the things we do is have some crackers and something to drink sitting on the bedside table for you ready. So let's get something in your belly and keep that under control. The next thing is more than likely you're going to need to urinate. Do not hold it. Our goal is to get you up and out of the bed in 4 hours no matter what. That is incredibly important to help you to have a faster, safer recovery. So when you think you might need to pee, let the staff know. We're going to come in with a walker. We're going to help get you up to the restroom. And then we're going to have you sit in the recliner, because that's a really good time for our physical therapists to see you up, come in, and start working with you. There's not going to be a lot of activity. They're going to ask you about, do you have steps at home? Do you have multiple levels? They're going to walk with you in the room a little bit, show you how to get up and down, just like what we talked about earlier. If you do go home same day, they'll probably bring you into this room and you'll practice going up and down steps. We play it by ear. We see how you're doing, okay? Our goal here is to make sure that you have a safe recovery. If for any reason me or my staff or any of the physicians, anybody feels that something's wrong, we're going to keep you, because we want to send you out of here 150% better than when you came in. So you've walked to physical therapy, you've gone to the restroom, you've got something in your belly. Now the one that's probably the most important to me and my staff up here on the floor, let's talk about pain management. Everybody recovers from surgery different. Everybody has multiple levels of pain. I have chronic migraines. A Tylenol does not work for me, okay? So that's why we really work with you and we take a look at you holistically, because that's an important part of your recovery process. So the first thing that the nurses do is they put you on the right pain pill. Is it a narcotic? Most of the time, yes. Can you do it with just Tylenol? Sure. What we do is we start low and we work our way up. And the goal is to get you on the right medication that is going to let you rest with the least amount of side effects. I had a patient one time that was getting 10 milligrams of oxycodone. That's a strong medication, and it wasn't working for her. So I went into the room. I said, let's try something else. And I gave her some Tylenol and a muscle relaxer. And when I went to reassess her to see if the medication worked, she was sawing logs, which is great because that means I found something to help her. So just because a medication is strong does not mean that it's the right medication. And that just goes to prove a point too. I encourage my patients to try a muscle relaxer. If that works, it's a fantastic tool in our toolbox to utilize. Does it work for everybody? No. But for those it does work for, it's excellent. So we'll try that out. So we've got our pain pill. We've got our muscle relaxer. All of our surgeons use a long-acting medication after surgery. Depending on your doctor's preference, depends on which medication, but they work the same way. After the replacement is done, all around the soft tissue or in the joint goes that medication. That medication will slowly release over a 3-day period because we know the first 3 days after any kind of surgery are always the worst. While this doesn't take the pain away 100%, what it really does is it makes sure that we, the nurses, can have a good pain plan in place before you even leave. Because when you get home, the most important thing should be rest, recovery, and good physical therapy. I don't want you or your family or whoever is helping take care of you to be nervous because your pain is not managed. So we work really hard to get your pain medicine correct. Now, as a nurse, one of the things that's important to me is really being able to manage your pain as best I can, maybe without any kind of medication. That's why we do other methods of pain management together to be more effective. So let's talk about your first friend. This is your polar cube, okay? What this does is it plugs into the wall with an adapter. And while you are here in the hospital, the staff will fill this up with ice and water, okay? The ice and water is circulated from a pump through a hose to a pad. When you are sitting in your recliner, you can put the pad here, here. Sometimes patients will complain about pain underneath their knee. That's okay to put it here. Sometimes people complain about pain here. That's more common with a hip, but it can happen. I don't care where you put this, put it on your leg, okay? The nice thing about the polar cube is this is constantly circulating cold water, which means that that little pad can stay in place for extended periods of time. That's incredibly beneficial because when you go to bed at night, you can put the pad in place. When you come home from physical therapy, if you fall asleep, that's not a problem. A little trick that I do have for you is when you get home, or even before you come in on the day of surgery, I want you to have 8 16-ounce bottles of water frozen. If there is a label, I do recommend that you take it off so it doesn't get stuck in the filter. And then pour out a little bit of water so that when it expands, it doesn't pop the bottle, okay? The cooler has a fill line. You're gonna fill to there with water. Take 4 bottles out of the freezer, put them in, and then all you do is put the lid on and it starts working. Take the pad and put it in a pillowcase. That way it'll help provide a barrier on you and it'll help to absorb some of the condensation. So again, if you're not up and walking around, you are icing and elevating. So your polar cube is going to be probably the one thing that patients say helps them sometimes even more than pain medication. So ice, 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 ice. And I have had people ask me, well, Stacy, can I do heat after surgery? No, you want to ice the area. Heat will bring more inflammation. We're trying to calm it down. So always ice after surgery. Next, patients have asked me about those gel packs. Well, I do still give you these refreezable gel packs. These are awesome to use when you go to your physical therapy appointments. So 30 minutes to an hour before physical therapy, I want you to make sure that you take your pain medication. It is incredibly important to be pre-medicated before therapy. They are going to kick your butt. They're going to push you hard. You got to have that medicine in you and working. Don't try to be a hero and say, I'll take it when I get home. When your pain gets way too high, it's incredibly hard to bring it back down to be in control. So always, always, always pre-medicate before therapy. Now, the next thing is that these gel packs are going to go inside this little black pouch, okay? You get 2 of them in place. This is going to sit over top of your knee when you go for your physical therapy. I want you to have it in the car. When you're done with physical therapy and you get back in the car, put it back on your knee. The ones do have a Velcro that you can wrap around if you want to keep it in place. I don't. I'm a big fan of just kind of letting it just sit there. So when you get home, though, I want you to switch back to your polar cube, okay? This is important because this is constantly circulating cold water, which means it can stay in place for extended periods of time. This is like the bag of frozen peas. If this sits in one area for a certain amount of time, that can cause a cold injury. So do not put this back on when you get home. Switch back to your polar cube. All right. So next in our pain management toolbox, I always like to ask, first off, if a patient has a pacemaker, spinal cord stimulator, bladder stimulator, anything that provides an electrical impulse. A loop recorder does not count. Just anything that actually provides electricity. You cannot have this next piece of equipment. If you do not have any of those things implanted in you, you will get a TENS unit. If you have not used one of these before, a TENS unit stands for transcutaneous electrical nerve stimulator. And the nice thing about the TENS unit is what it does is it stimulates the muscle and the nerve to give a slight vibrating sensation. And that actually has your body release endorphins, which are a natural painkiller. This helps the muscles in the leg to relax. Most of the time after surgery, they're incredibly tight here and they're super tight here. This is preset for you, so you do not have to touch any settings here. And it also comes with a 9-volt battery, all right? I would strongly recommend getting some more 9-volt batteries because the more that you use this, the higher your number goes and the more that you will go through a battery. This is placed on in the recovery room, and it is not turned on until you come upstairs and you start to have pain. So respectively, you have 4 little pads, and you may have 2 pads down there and 2 pads up here, somewhere around the knee, okay? When you tell me or one of the other nurses that you're having pain, that's when we start to turn this on. So what I'll do is I'll say, you know what, tell me when you can feel this. And ever so slowly, we turn it on. Now, the best way to think about this is I want you to turn it on like you would turn up the volume in the car, nice and slow. I do not want to walk in your room and all of a sudden I see your leg twitching like this. That means that this is too high. So slow and steady. When you can feel that sensation, that's when we stop and then we turn on the other side. Okay. Use this as much or as little as you like. I will tell you that on a personal note, I can wear this for a couple hours on my lower back, on my shoulder, wherever I'm having pain, and I don't need ibuprofen or Tylenol. So for me, this is a fantastic method of pain management. I've also had some patients that tell me that it doesn't really do anything for them and they don't like it. Guess what? That's okay. That is why we give you all of these methods of pain management. So if you get a TENS unit, we will go over the rest of the functions with you while you are here. And now for pain management, we've got our pain pill, we've got our muscle relaxer, we've got our long-acting medication after surgery, we've got a TENS unit, our jelly packs, and our polar cube. So your pain management plan will be in place before you even leave the hospital. So now that we've got your pain plan set, you have decided that you want to spend the night because you were recovering a little slower from anesthesia. So the staff is going to wake you up about 5:30, 6 o'clock in the morning. I know it's early. I'm so sorry. And we're going to get you into the bathroom, get you washed up, get you dressed. When you're done, the nurse is going to have you either get back into bed or in the recliner, and she's going to get ready to take a look at that bandage. After a knee replacement, you are going to be wrapped up with an ACE bandage from your ankle all the way up to your leg. Okay, that ACE bandage comes off. Underneath, there's some fluff. That fluff will come off. And underneath of that fluff is your surgical dressing. So this is a very special dressing. This is actually one for a knee. The nice thing about this is it has really thick silicone, okay? The silicone warms up with your body temperature and it creates a super, super good seal. We have found through evidence that the longer you keep a joint replacement incision covered, that the less chance of having an infection happen. So the cool thing about this is this can stay in place for 10 to 14 days. And that's what I want. Notice on the back of it that it's silver. That means that it is, silver has antibacterial properties, okay? Now, we've taken a look at that bandage, and the nurse is going to go ahead and give you your pain medicine. She's going to get you all ready. Let's say the nurse had to change that dressing because you had a little bit more than was anticipated. That's okay. I always send you home with an extra dressing and a cleaner, okay? Let's talk about that surgical dressing, and we're going to take a look at the picture because this is what's important for you to pay attention to. When you go home, there's only 2 reasons that you would change that dressing. One is if it is 100% saturated, just like right here, okay? So let's say that you've got just a little bit, that's fine. We're going to observe because you have light shadowing, okay? If you hear somebody say shadowing, that just means the amount of drainage that's on your dressing. Let's say you've gotten a couple physical therapy appointments and you've had a little bit more. Let's just say now you're moderate. You're just going to monitor this dressing. Still not changing it, not doing anything. If you have a dressing that looks like this, the entire thing is saturated, you have got to change it, okay? That's why we provide you the extra dressing and the cleaner when you go home. So again, observe for just a light amount, monitor if you have more, so a moderate amount, change if you're saturated. The only other reason that you would change that dressing at home would be if it got wet, and that is why we have this press and seal on your shopping list and on the table right now. If you want to get in the shower, you can absolutely do that as soon as you get home. But I want to show you how you need to wrap it because this is important. For argument's sake, I'm not going to put it on my knee. We're going to do it on my shin, but the premise is the same, so you'll be able to tell. All right, so I've got my dressing right here. You are going to tear off 3 sheets of press and seal. Now, they don't need to wrap around your leg in the back. That's not a big deal. I do want to tell you, please do not do this. You are going to be incredibly tempted to wrap your leg up that way. If you've ever used a piece of saran wrap, you know once it gets stuck on itself, you can't do anything about it. This is the same way. If this gets stuck like that, the only way to get that off is to cut it. So if you wrap that tight around your leg and it's tight, you may have accidentally created a tourniquet. Don't do that. That's why I want you to tear off 3 sheets of press and seal. All right? So, our bandage, which is on our knee, you're going to layer this like you would layer shingles on a roof. So the first piece is going to go down here. Press it down on the skin. You see how I have a nice gap down there? Leave that like that. Your second piece of press and seal is going to go over top. Press it down, just like that. And then your third piece is going to go right on top, just like that. And that's all you have to do. Press, it will seal around your skin. You can hop in the shower, get washed up. When you get out of the shower, you're going to peel it down from the top, okay? This is what I like about it. If you have fragile skin and you bruise easy, you're not going to tear skin, you're not going to bruise. It won't pull up any hair, and more importantly, it's going to come right off of that bandage, just like that. So anytime you want to shower and your bandage is in place, you have got to cover it up, all right? When the surgeon takes off the bandage and says that you don't have to have it covered anymore, that's when you know. So we have checked on the bandage. The nurse has not changed it. You know that you can take a shower when you go home, but you got to wrap it up with press and seal. Now the evil nursing assistant comes in. Folks, I say that because I was once an evil nursing assistant myself. And these bad boys are going to be what they're going to put on. If you have never worn these before nor seen them, these are what we call compression stockings. These are meant to be tight. There is a reason behind the madness. The most important thing for a compression stocking truly is that it helps to prevent you from getting a blood clot, which after any kind of orthopedic surgery, you are at an increased risk. And we don't want you to get a clot because clots cause strokes. So your surgeon wants you to wear your compression stockings for 6 weeks, 20 hours a day on both legs. Now you say, how in the world am I going to make that happen? First of all, you cannot put these stockings on by yourself. You need to have somebody that loves you very much. I'm going to show you a trick. I strongly recommend that you get some baby powder or cornstarch. And I prefer to use a zippy plastic bag. You'll see why. You can use a plastic grocery bag, that works too. Sometimes what our nursing assistants will do is they'll save the bag the stockings come in and use this. Also know that our stockings, we do measure you for them to make sure that you get the right size, and you do go home with 3 pairs. Do not put these in the dryer. I would recommend washing them in the sink with a little bit of dish soap and then letting them air dry. So let's do the trick, okay? Again, you can't cross your legs like this because you're going to be swollen, so have somebody help you put these on. Go ahead and get your baby powder, and you're going to put it all over the foot and your shoe, apparently. You can put it all the way up the leg, all right? You can even put it over the dressing. It's not going to hurt anything. And then take your plastic bag, put it over your foot. And these are brand new stockings. I just opened up that package today, so you can see that this is true, how easy this is. The blue square is where the heel goes. Once you get past that blue square, this is a lot easier to do. So if I were going to put these stockings on you, I would grab it just like this, and I would put it on top of that plastic bag, okay? And now, this is all you have to do. I didn't put forth a whole lot of effort, folks, to get that up. Now, a little trick for a knee, instead of tugging it up like this, lift up a little bit, especially when you get to here, lift up over the knee. And when I get to about here on my patients, that's usually when I tell them to go ahead and grab the rest of it and pull it up. Because then that way you're strengthening these muscles, which are going to help you as you're pushing up and down. So take this and pull it up all the rest of the way. We're all out of fishnet. Sorry, you get some nice white ones. How about that plastic bag? Well, open up that right there, take the edge, and pull it out. I promise you there is no easier way to put these stockings on. You can put the hole wherever you want. I would prefer probably just to have it be right there. Another thing is we do give you 3 pairs because these particular stockings have graduated areas of compression. So from here to here is one amount of compression, here to here is another, and then here to here is another. So please make sure that you are wearing these 20 hours a day. If it were me and I were going to wear them, I would wear them to bed when I'm not moving. If I had a 9 o'clock physical therapy appointment, I would take a quick little bird bath before PT, go to my appointment. When I came home, I would have my husband take my stockings off, take a shower, and I would rest for about 4 hours. And then I would put them back, and then I'd have him put them back on me. So now that we've got your stockings on both of your legs, you're going to get your shoe put back on, and then you're actually going to come into this room right here. This is our physical therapy room. It's a beautiful blue, and you're going to do a lot of the activities that are actually in your book. You're going to go through some other exercises. We're going to have you go up and down steps. And then when therapy is done, we're going to ice you down and we're going to have you watch a discharge video. And that video is of me and another nurse. And really, it's going to hit the high points on everything that we talked about today. Our goal is really to help you have a great educational resource that you can refer back to afterwards. And again, if you want to watch this whole video again, you are more than welcome to. So after you are done with your physical therapy session, you're going to go back to the room. The nurse will go over your pain medicine, and we will get you home. A couple things to note. It is really important for you to call the physician office or for you to come to the emergency room for certain things. First and foremost, if you are having chest pain, shortness of breath, anything that would make you think to call the rescue squad, do that, okay? Do not call Stacy Brock. Do not call your doctor's office. Call EMS because they're going to bring you to the hospital. The second thing, if you all of a sudden are having pain and you cannot stand on your leg where you've been up and walking around for the past couple of days, that could be indicative of an issue that you need to call your doctor's office. If you are having problems and your pain medicine is not working, Stacy Brock is just an RN. She cannot give you any pain medicine. So you do need to call your physician's office because they are the only ones that can do prescription pain management. And then lastly, another important thing is if you are having swelling and heat and redness to your operative leg, that could be a sign that you have a blood clot. Now, let me preface that by telling you, if you have redness and swelling, there is some that is normal, but the heat and the redness on your leg would be like a 3rd-degree sunburn, and the swelling would be incredibly, incredibly noticeable. You wouldn't even be able to touch that leg very gently without it being painful. That would be something, again, that you need to come to the emergency room for. So I hope this video was informative. I really, really, really do think it makes a big difference in your recovery. And I just want to welcome you to Carteret Healthcare. I hope that you have a happy and safe recovery, and we will see you soon. Thank you so much. Bye-bye.